I'm Grant Jones and I'm an orthopedic surgeon at OSU Sports Medicine. The labrum is a rim of cartilage that surrounds the shoulder joint, and it serves several different purposes. One is it deepens the socket of the joint to provide stability to the joint. The other is it provides the attachment for all the ligaments that help stabilize the joint. In addition, it provides the attachment for the long head of the biceps tendon as it goes into the shoulder joint. There are several different mechanisms of injury. It can be a traumatic type injury, such as if one dislocates their shoulder either out the front or out the back. In that case, the labrum pulls off the bone and has an acute traumatic event. The other possibility is a repetitive microtrauma type situation that we see in overhead athletes such as baseball players, gymnasts, softball players, volleyball players, where repetitive motions of the arm provide a mechanism to kind of peel off the labrum and cause injury to the labrum. Not every labral tear needs to be surgically repaired. Often these repetitive overuse type labral tears can be treated with a conservative management program, including a physical therapy program to work on the muscles that help stabilize the joint to take some of the tension and pressure off the labrum. We can also treat them with anti-inflammatory medications. In other words, if someone has an injury to the labrum from this repetitive overuse type situation, they get inflammation in the shoulder, we'll provide some anti-inflammatory medications to calm down the inflammation and then allow them to participate in a physical therapy program. And a majority of these type situations respond to a more conservative type approach. Now, if one has an acute traumatic injury to the labrum, such as if they dislocated their shoulder either out the front or out the back, and they're a young active person, those people are often more aggressive in surgically treating those because they'll have problems with recurrent instability if we don't treat those that way. After surgical repair of the labrum, it is a long recovery process. One is in a sling for approximately 6 weeks. We begin therapy 2 or 3 weeks in just for some gentle range of motion type exercises that we do for the first 6 weeks. At 6 weeks, we start some gradual active exercises where we start using the muscle groups to move the shoulder, and then gradually progress into a strengthening program around 10 to 12 weeks. And then from 12 to 24 weeks, we continue with the strengthening type program and gradually introduce more sport-specific activities. So overall, I tell people it's a 4 to 6 month type recovery after this type of surgery. OSU Sports Medicine specializes in these type of sports type injuries such as labral tears. And if you want to get the best outcome from this type of surgery, you want to go to a specialist that specializes not only in repairing the labrum but also in athletes so that you can get an appropriate type of recovery to get back to your sport. As a fellow sports enthusiast, particularly an extreme sport enthusiast, I do understand that you do take risks when participating in these type of activities. This is a helmet cam from some recent skiing trips that I've taken, me going down a mountain. If you do have the unfortunate experience to have an injury with one of these activities, feel comfortable to know that OSU Sports Medicine has you covered.